are joining us today. So today we will focus on respiratory illnesses. So today we have a doctor from India, besides Dr. Abel from Peru, and we have Dr. Lennie Soo at the same time. So today we have 3 doctors joining us today. So I believe Dr. Abel have actually get it a lot. Let me check. Is Dr. Gajira here already? Okay. So this is our 3rd series already. Welcome everybody. So I think I will invite Dr. Soo, which is the founder for I-Inspire, to just share about the background since when we are doing this and why we are doing this. Then after that, we will pass back to Dr. Abel and other guest speaker. Dr. Lennie, let me pass the floor to you.
Thank you very much, Hooi Lin, the President of Persatuan I-Inspire. Today, I am honored to have 2 very, very important people, in this webinar with us. And I think without further ado, I think everyone knows Dr. Abel Hernandez, who is joining us from Peru, and a new face, Dr. Girija, who is joining us from India, who will be a constant with us from now on, I hope. Yes. Right? And our topic today is on respiratory diseases. And before we start this this talk on respiratory diseases, I would like to you all to know that respiratory diseases is not just about difficulties with breathing. It's not just about asthma or bronchitis or anything like that. It can actually be related to the heart as well, because like COPD, chronic pulmonary heart problems. And we are going to kind of like talk about all this, but because of the time limit, we don't have much time. So a lot of this discussion will be based on testimonials that Dr. Abel has connected, Dr. Girija's work with respiratory illnesses and lung diseases in India, and we are going to look at it from a Ayurvedic and wellness and complementary and alternative perspective. Of course, we are not saying that medical medicine, like the Western medicine or the allopathic medicine is wrong. What we are simply saying is that there is alternatives and there is some sort of complementary treatment to all these diseases as well. All right, so without further ado, Dr. Abel Hernandez, are you ready?
Yes.
Okay, yes. All right. Ready. I'll pass the floor to you.
Well, first of all, it's a great joy. It's a great joy to share this webinar with Dr. Lennie and now Dr. Girija from India. It is wonderful. These are opportunities to share our experiences and grow together. The respiratory problems are very, very interesting. It says life start with an inspiration. And by the way, we have I-Inspire here. Inspire you to believe something, but also inspire means breathing in. So life starts with breathing in. However, some people do have some difficulties breathing in. And as Dr. Lennie says, it's not only when you can breathe in through the nose, also at the cellular level. That's when we talk about the circulation and so on. Because sometimes, like just recently in the last 2 years, 3 years, now many people were having problems breathing, and it was no ventilation problem. No, the breathing through the nose, it was at the cellular level. So there was a lot of protocols which were not really the best protocol for treatment. However, let's not get into that side right now. And let me share you with you one of the first experiences we have with Homa Therapy. That to me, it shocks my base, my so-called solid rocky face in medicine, because it's Homa Therapy is based on bioenergetic fires, Vedic fires, and from our usually academic understanding, fires are no good. I mean, you cannot breathe the smoke. The smoke has harmful and so on. So while I was in the US getting all this, I was very cautious, because if I have people in front of me and somebody will have respiratory problems in front of this fire, I could get into big trouble. However, many of the people who came to these sessions, they were hopeless cases of many diseases. So when you're in the hopeless stage, there is nothing worse that can happen. Whatever is worse is. So we have people who have respiratory problems.
Okay, thank you, Dr. Abel, for a moment. Dr. Girija, do you have anything to add from India side on respiratory diseases?
First of all, namaste, Dr. Lennie, namaste, Dr. Abel,
Namaste.
and namaste to everyone who has joined this session. And I'm really very happy to interact with you all regarding these respiratory illnesses. So just now we have experienced the havoc created because of the COVID pandemic, where suddenly the data regarding medical data was getting exchanged, and people started evaluating their oxygen concentration in the blood. Also, they were evaluating or very much scared about the X-rays, their CT scores. Everyone was discussing this. Overall, the situation was very scary. And I'm sure many of us or some of us must have visited the ICUs, where the horrifying situation, the external life support was necessary. And because of this situation, everyone was scared, and scared because of the uncertainty of life. So, and at that time, everyone started or became aware about how do we remain healthy, and they started then searching for the healthier lifestyles, and how do we eat healthy food, and how do we follow healthy lifestyles. And also followed many people joined our Agnihotra therapy as their main therapy. So
Okay.
yeah,
Thank you so much for that. For that look from the Indian side, and it's good, right? I mean, Homa therapy, although it is very smoky sometimes, it actually can kind of have a positive effect on the respiratory system. I pass it back now to Dr. Abel. Dr. Abel, you have some testimonies you'd like to show us?
Yes. I'd like to start the testimony from the simple ones, the very common ones, and then to the complicated ones. So we'll do something, for example, asthma, then with probably some allergies, and then emphysema, and then COVID. That's good variety for now. So let's see. Let's see. Do I have the possibility to share now? Yes. Okay, we do. Okay, let me close here and
while waiting for Dr. Abel to share, Dr. Girija, I'm sure you have a lot of testimonies from India as well on respiratory, right?
yes, ma'am. I have treated hundreds plus patients of respiratory diseases, as Dr. Abel said, right from milder diseases like common cold or cough or allergic rhinitis, from
Okay.
to the severe diseases like bronchitis or chronic asthma, etc. So
Okay.
I have made, like I have what you can say, I wanted to share few from them. So should I start it now on the
No,
same?
let Dr. Abel show us his testimonies first.
Okay.
Dr. Abel, over to you.
Okay, we're here now. Okay, this is a lady from the US, and it's Donna. It's very simple. These testimonies that we have today are very short.
Wow, Dr. Girija, I mean, you just saw that testimony. What's your opinion on that?
I was not able to hear it at all, ma'am.
Yeah, but you could read the subtitles, right?
I missed that, ma'am,
Oh,
unfortunately.
you missed that. Okay, all right. Dr. Abel, amazing case that.
We can play it back. It's 2 minutes. But,
Yes, okay, let us play it back. But can you share the sound as well? That is incredible. In 3 months, it cleared, right? That is
that's
so
correct.
incredible. Yeah, that is incredible. What do you think about that, Dr. Girija? Do you have that kind of experience before?
Yes, Dr. Lennie, we have many more like this, and as in our center, which is situated in our ashram, since last 50 years, we have been practicing this as a basic like main therapy system along with the other Ayurvedic herbs. So in our like center, we are treating the patients with performing Agnihotra when at sunrise and sunset. And so we have seen that the patients with COVID also, as I have handled like 200 plus patients during this pandemic remotely, as the situation that was like that, nobody could enter the center, or I could not go outside to meet the patients. That's why I treated them online. And there we have like advised them to perform Agnihotra. And I'm very happy to share with you that everyone everyone got relief with this Agnihotra practice daily, and also felt they have improved with their immunity system. Also, we have asked them to stay there like for 15 minutes in that atmosphere, and doing the breathing exercises, which we call as a pranayama, along with this Agnihotra. And
okay, that is very interesting.
yes,
So Agnihotra and with Ayurvedic treatment, right?
yes,
Simultaneously, and you do that online.
yeah, because
That's amazing.
COVID taught us all these things. Then
Yes.
then now I practice both, like online also for patients, and offline, like patients come here for taking consultations.
Thank you.
Yeah.
And Dr. Abel, one of our guests tonight, Horacio Bulo, asked if there is any x-rays that we can show regarding the lungs respiratory diseases that was earlier. I think Dr. Abel should have it, but we will not show any of the x-rays at this moment. Horacio, you just be patient. We will send it to you later, because we have quite a few videos to share at this moment. But we will get back to you. And yes, there is an X-ray. Dr. Abel, I pass the floor back to you. Shall we see your next testimony?
Definitely. By the way, I'd like to say hello to Dr. Horacio Bulo. He is from Argentina. He is a pneumologist also. He's especially in this area. And yes, the case that you heard was in the US, and she talked about the X-ray and so on. But we don't have when I met her, she was completely well, and she was very happy. She have already years, but that was her first experience. However, I invite Dr. Bulo to do some experiences with his patients and not to be afraid, and that they are going to get complicated in front of the fire. Expose the people to the fire, get the X-ray before, and then later, and he will share this X-ray himself. And now that will not be retouched, because he knows straight from the source. This is a possibility. But at the moment, let's share another one. Let me check over here and see what we can look for.
Excuse me, can I ask, excuse me, but by my English is very basic, but never asthma is evaluated with X-ray. It is impossible to be say that it's very good if you only see an X-ray. You need to have a spirometry and the other valoration for to say that the asthma it is better.
Okay.
Point taken, Dr. Horacio, point taken. I understand what you're saying, and your input on this is very, very important to us. And you are right, I mean, asthma cannot be detected through X-ray, but except for some certain things. But maybe we can share more with you the case, or and we can contact you with the case later, and we will see from there. We are trying to compile more cases, that are medically relevant, and we would love to have you as part of our team. Dr. Horacio, thank you, and we will definitely come back to you on that.
Okay,
Now,
thank you.
but let's look at this now. We'll show another asthma, and there is no X-ray there. This is a lady who's showing the inhalers. You know that she was using for the breathing with her child, and she have been going also to specialists, and they were told that they have asthma and so on. Now, realize this. The first case was in the US, Donna Scott, okay? And she went to lung specialist, and this is what she was told. It could have any other lung problems, independent of asthma. If there was black lungs, it could be many different things. Anyway, that's why when we talk about this here, I say we have lung problems, and not specifically because you don't have anything to back up the diagnosis. If we had the information, that we can say it, but we're talking in general lung problems according to the patients and according to what the doctors told them. So let me show this case. Simple, but it might be interesting to you. Now, 4 years later, we happen to see them again.
That is another really amazing testimony. Yeah. Dr. Girija, what do you have to say about that?
Very great case he has presented, and very satisfied with that. Very well done, doctor. Yeah.
Now, this is very challenging because, as I say, in medicine, respiratory problems and smoke, they're not, not compatible. The smoke is not good. We all know, since we are child, we have been told that. And so when I heard this first in the US, I said, this is not possible. This is definitely not possible. Anybody knows that the smoke is toxic, and all the smoke should be toxic, and that is not possible. It's just nonsense. However, as a scientist, you have to experiment. If you refuse to experiment, you are just a fanatic, whether you believe in science or whatever. But the test is the experience. So everybody was coming with, and people were getting better. And I told people, don't believe anything. This is not possible, but let's experiment anyway. And surprisingly, people who have known for years. I remember one case, not all men, was our age, but at the time you think he's old, 70 years old, we think he's an old man. You have this asthma, he was calling asthma inhalers more than half of his life. And he came with his wife. He will not come into the Homa Therapy because he was afraid of the smoke. So he will stay in the car outside. So his name was Juan. He said, Juan, how are you? He said, oh, I'm okay, but I'm stay here because, smoke is not good for me. I said, well, I leave the door open. You can try to come closer. If you have any problems, run out. Don't worry about it. Anyway, we started the Agnihotra. He was at the door, almost outside. And we did the fire, do a little short meditation, open the eyes, and surprise. When we finished, he was right in front of a pyramid, inhaling this. I can breathe better. I can inhale better. All this. And I said, how is this happening? This is not possible. So one case after another. I say, I don't know anything. I put it to the test and let it happen. But asthma is one of the most common and easy ones to be treated with Homa Therapy. Don't believe anything, do it. If you're afraid, don't do anything because you have this kind of thing. But this is a different smoke. This is not the regular toxic smoke. There's something special about this healing smoke. So, but I do understand, as I said, Dr. Bullo, because I come from the same background. This is not possible. This is nonsense. However, what are you going to believe? What is happening in front of your eyes on what you were taught and you have seen for? Definitely, you have seen it in your experience. But with Homa Therapy, it's a different story. I invite you to put it to the test, not just theorize, but with the patients. And what stops the doctors usually is the fear. something that complicated, and this is not possible. So I understand. Anyway, and does, if Dr. Bullo or Dr. Girilla want to say something else, otherwise I'll show you another video. Okay. Since time is running, let me show you something else. Then, you know, nowadays allergies are quite common. A lot of people suffer with allergies, and maybe 60, 70 years ago, there was not so many, but now people are allergic on many problems, many things. And they do a special test to identify what is the cause. But this was very interesting because this was a child. This was also the US. By the way, in the US, medicine is very strict, very rigid. You have to follow certain criteria. And if it doesn't follow these criteria, it's not considered. These holistic medicines in the US, these alternative medicines, these herbs and so on, they have lately come into the picture, but still the conventional medicine is the only one that can prescribe and it can diagnose a disease. Nobody else, only a conventional medical doctor can diagnose and it can prescribe medicine in the US. But when you have a child which have allergies, well, I will not talk more. I will show you the mother who had the child. Let's see if I can, second. Mothers worry very much because when you have a child that has difficulty breathing and they cannot do anything, is really, let's see. Once again, this is in West Palm Beach in Florida, US. I think that was an exaggeration 10,000 times, but it's still probably a lot of times. This is very interesting. You know, the test shows that he still have a lot of allergies, but he lives a normal life. Okay, This is, I'll talk more about it later, but let's continue. Very interesting. Diego is somebody who learned Agnihotra here in Peru, and he happened to be traveling to the US in Florida. So he was visiting these friends, and the child was born with these allergies, and he had to stay in the hospital and practically living there continuously because he was allergic to everything. So Diego said, why don't you try with the fires, the ash? No, he's allergic, that's not possible. He said, well, what do you have to lose? And gave some ash. And with the ash, he experiences some benefits, and then he increased the benefits once the fire was done. That was the child.
Very interesting case study, Dr. Abel.
Yes, it's
Dr. Horacio, just now you raised your hands. Did you have a question?
I don't understand. Can you translate me, please, Abel?
Okay, I'll try. Usted es un niño que nació con alergias en los Estados Unidos, en Florida. Entonces, un amigo nuestro que se llama Diego, que aprendió la terapia Homa acá en Perú, fue a visitarlos y le dijeron que el niño nació con alergias a todo. Lo dicen como los niños burbujas, que tienen que estar todo bien, súper esterilizado y eso. El alimento, incluso la agua, tiene que ser agua como agua destilada. Y todo le creía reacción y tenía eczema. Ese es el problema en la piel, las alergias, todo eso. Y le tenían que dar la comida por tubo, el alimento, mejor dicho, por tubo. Entonces le dijo, Diego, ¿por qué no tratas? Y le dio la ceniza de Agnihotra. Le dio y le pusieron un poquito en la eczema y se desapareció donde le pusieron. Entonces dijo, bueno, ¿por qué no trata un poquito más? Y comenzaron los fuegos. Bueno, ese niño a los 2 meses ya no tenía nada. Pasaron 7, 8 años y los exámenes, porque le hicieron todo tipo de pruebas. Usted sabe que le hacen unas pullitas ahí para hacerle determinar cuál es el agente alérgico, ¿no? Todos dicen, le encontraron para todo, pero y todavía después de 18 años aparecían que era alérgico, con la diferencia de que él tenía una vida normal, comía de todo y no tenía ningún problema, no tenía alergia, no tenía nada. Una cuestión es lo que dicen la parte clínica y otra cosa es lo que muestra el paciente. ¿Ok? Y eso es interesante, muy interesante, porque nosotros generalmente, la mayoría de los médicos nuevos están basados en los exámenes de laboratorio y todo lo que dicen. Pero los médicos viejitos Yo tuve la fortuna de tener un maestro de 90 años, un médico en los Estados Unidos, que me dice, no, si cuando tengan casos nuevos, básate en lo que se llama en la parte física, en la evidencia física, y no lo que te dicen los exámenes. Porque en última instancia lo que vale es el paciente, no lo que dice el laboratorio. Y entonces me recuerda eso. Esto está pasando en los Estados Unidos, donde está la más tecnología avanzada y todo eso, pero la evidencia es más fuerte que todas las demás cosas. Entonces, eso es para cada quien lo procese de la forma que considere, ¿no? Pero esto mueve los esquemas. Oh, okay. Gracias, Dr. Bullo.
Thank you, Dr. Horacio, for the question, and thank you, Dr. Abel. Amazing testimony, right, about the child, and even the eczema and all the allergies just disappears. Dr. Girija, what is your comment on that? That is an amazing case again, you know.
Yeah, ma'am. We have been treating this different kind of all diseases with the help of Agnihotra as a main therapy along with Ayurvedic herbs. For different
what do you think
systems.
about the ash and the ghee thing that she was talking about?
Yes, we have been using it from many years, and it gives definitely good results in different kind of infections. Also, not only in eczema, in different kind of like allergies, also in boils. Also, we get the relief with this application of the ointment. It has to be done in a very that ghee and what do you call the Agnihotra ash that we are mixing constantly. We are double boiling it and we are mixing it, and then we are applying on wounds. Also are getting healed with this. Also, I want to share with you that I have seen a patient who had a dog bite. There also that patient applied this Agnihotra ash after cleaning the wound.
So it's ghee and Agnihotra, right?
Yes, ghee and Agnihotra ash, and that patient was now she is like I'm seeing her for last 3 years, and she has not affected with that dog bite, and she is very healthy. And she is a Delhi Agnihotra performer.
Thank you, Dr. Girija.
Yes.
That's
Also,
amazing, you know.
Yeah. Also, Dr. Lennie, I would like to explain, like, as we are discussing about these respiratory illnesses. So I would like to share how Ayurveda thinks about these diseases.
Okay.
So yeah. So for that we have to understand how we divide how we explain the respiratory system. It is based on the like anatomy and physiology of the system. We can divide it into the upper respiratory system and lower respiratory system that everyone knows. But what Ayurveda thinks, the upper respiratory system, which consists of nose, throat, like nose, pharynx, larynx, etc. It is a site for Vata predominance, that is air energy predominance. And the lower respiratory system consists of the trachea, lungs, etc. So it is the main site of Kapha, that is the water energy. So the function in this system is it functions properly when the equilibrium is there, and we get diseases when this equilibrium is distorted, and then we get different diseases. So here we are treating many patients in our center for so many years. As I mentioned earlier, we are giving Agnihotra fumes as inhalation. And if the other, like the lower respiratory system is also involved, there we are using Agnihotra fumes along with some gargles, or it can be consumed along with water, like hot water. Also, we have me and my husband has developed the Agnihotra ash, based supplements, which has
Okay.
yeah, like this. And like I would like to show everyone these kind of supplements we have created for different systems, and these are FDA approved. So, and we have been using it for last 5 years. Okay, so it is easily palatable also. People are getting benefit with these supplements.
Amazing. Thank you
Yeah.
so much. Yes, thank you so much. That's amazing. I mean, so in every one of the supplements, you put some agni ash in it.
Yes. Yes.
Okay, cool.
And
Okay, let's
also,
continue on with, yeah, sorry. Sorry,
yeah,
Dr.
and so we have like formulated this 5 years since 5 years, but uh, as in the form of decoction, or we in the herbal combinations, we have been using it for last so many, like 50 plus years.
Okay, wow, 50 plus years.
Yeah.
That is evidence-based for you, right?
Yeah.
Okay, I'll send the floor back to Dr. Abel. Dr. Abel, you have another testimony to show us?
We have many, we have thousands of testimonies to share. We have so many, but now this is very interesting because I have one testimony of India, of Pooja.
Oh.
Pooja have a problem with the skin, and we can say it's an allergy because it affects the whole body and so on. However, it was an iatrogenic problem. It was induced by an injection. So by doctors, they put an injection and there was the reaction. And I'd like you to tie your belt, because what you're gonna see, you're not gonna believe. In fact, when they sent me the pictures, we were in Peru, that was happening in India. They sent me the pictures and say, I have seen many things, but this I cannot believe. We have to go there. I'd like to see myself and be with these people and check everybody, because this is not possible. What I'm talking about, you will see, okay? And again, like we tell everybody, don't believe anything. You believe anything right away, you are a fanatic. You put it to the test, you will know the truth. So let me share Pooja. This is in India, okay, Dr. Girija, but this you will see, this is close to indoor, she knows. Let me. Close to Dule. Amalner is in Amalner. Can everybody there see? You speak Hindi, you will know. If you don't speak Hindi, you also will know. This is Dr. Bullo. This is Spanish here, the title, but that engineer Dilip will talk in English now.
Well, that is amazing, Dr. Abel. So, can you explain a little bit in English the case? Dr. Abel, can you explain a bit in English the case?
You can see her there sitting with the mother front of the fire.
Yes. Dr. Abel, can you explain a little bit that case in English, please?
Second.
I can see that she has got very severe eczema. Can you explain the case a little bit in English?
Okay. Well, this girl, she went to the doctor. It seemed like she had a problem, a medical problem. It could have been urinary infection, whatever it was, because they injected some sulfa drug, and there was a reaction, and the reaction provoked that she was bleeding throughout the whole body. She had these wounds, some kind of bleeding, and
they said that it was incurable, right?
They said 21 doctors said that was incurable. And she was told there is nothing we can do. Go home and let her die. Okay? Go home and let her die. That was when she was about 7 years old. 8 years later, they met Engineer Patil, the gentleman that is standing there talking in English. He gave them, try the ash, try the Agnihotra ash, and they tried the ash and it felt better. And they said, well, now do the fire. And they did the fire. And so what happened? How long did it take to fix what they could not fix? 21 doctors could not solve in these 8 years. How long did it take with Homa Therapy? Did you hear? Did you catch that one?
I thought it's about a few weeks, right?
30 days, 1 month. In 1 month. Okay, I can play it.
Yeah.
I will send that to you because it is hard to believe. But all those people, they saw it. The mother and all those
so
people.
maybe the ash has got a detoxification effect because it all started with an injection that she had an allergic reaction to, and maybe the ash and the acne, just kind of clear or detoxify. I think, Dr. Gijira, you may have a better understanding of this. Can you share with us your knowledge?
Let me tell you one thing more.
Okay.
Look at this over here. Let me change the background because sometimes you cannot see very well with this kind of background. But I'll show you this 1 second. Can you see this?
Yes.
These are tablets. These tablets of Agnihotra ash. They are, what do you call it? Blisters made by the pharmaceutical company. And these are Agnihotra ash. Okay, Noya ash, Agnihotra ash. Now, these interesting blisters, they were produced by the main pharmaceutical company in Ecuador, the one that produces all the medicine for the biggest hospitals of the state in Ecuador. Why did they do this? For the following reason. One doctor, he was the director of the biggest hospital in Guayaquil. Guayaquil is the second most important city of Ecuador. Okay. We were visiting there. This director of the hospital, he got cured with Homa Therapy. He came to see a friend of us, another American doctor. He came with nervousness, and he asked Dr. Peterson, James Peterson. Now you will know him later on. I'll show you some videos with Dr. James Peterson, not today, but in another case. And this Dr. Gagliardo, the director of the hospital, comes to Dr. Peterson and says, listen, do you know anything I can do for this? I'm so nervous. I have so much anxiety. and I'm the director of the hospital. What can I do? I know what I can do, conventional medicine, but I cannot be dope. I cannot be drug. I had to perform. I had to be bright. I had to be healthy. And Dr. Peterson, he said, okay, let's do this. And they did Homa Therapy and they give the ash and he got healed. This is the director of the biggest hospital in Guayaquil, Ecuador. Anyway, Dr. Peterson said, let's talk to him. Let's see if we can go and work with the doctors there. I said, okay, let's go. We went to his office and they said, okay, let's talk about Homa Therapy. And this man, that the owner of the biggest pharmaceutical company of Ecuador, who produces the medicine for all the major hospitals of the state, was there. And he heard the conversation and he asked, do you think your medicine can help me? He said, I'm on the biggest pharmaceutical company. I can produce medicine. I can get medicine from anywhere in the world. I don't have any problem, but I have a problem that I cannot solve with this medicine. Do you think this can help me? I said, well, let's try. We don't waste anything. This is all these medicines, this ash, inihotrash is given for free, no charge. Okay, we give this for free. So I'll give you this, you put it to the test, you let me know. Anyway, surprise, no surprise, but for him was a surprise. He got well. He got well, and then we met again and said, well, what can I do for you now? I'm totally well. There was no medicine for me. And we said, well, if you want to, Dr. Gagliardo, the director of the major hospital, he told me, doctor, the problem we have with Homa Therapy is that ash and fire, people have difficulties, they see the cow dung case and all this, and they can get hesitant. But if we give them some pills, they will take any pill. Whatever pill you get, they will swallow it like nothing. Okay, so I said, well, why don't we take some samples? The doctors get some sample from the pharmaceutical company for testing, with the patients. I'll say, okay, we'll give you the ash, and if you can prepare some blisters, with all the criteria that we imply, that would be wonderful. So you count with that. So they produce these kind of blisters for all the modules, all the specialties in the hospital. That includes oncology, dermatology, ophthalmology. All of them receive these samples. They were told, just try it. They call it Homa Vida, Homa Life. They call that they put a name for this. And the only thing that we require is you have to put there, you have to write down free of distribution, no cost. That should not cost anything. Even though it costs to produce it and all this, I said, for us, we have to give it for free. You got healed and you could not get healed anywhere. Now let's do this. They try it, all the modules, everybody reported the patients speed up the healing. And all the different, whatever the situation was, they help to optimize the healing.
I think that is great. Yeah, I think that is great that we offer.
Later, they continue. They want to be just to give ash. It says, the idea is for you to learn the fires, put it to the practice, and teach the patients and so on. Not just create dependency. This is not to create dependency. This is to create people ability to help themselves. Anyway, empower the people. This is what happened with this. Like that, we have many more cases. Before
that is amazing, and to be able to give this to people for free, I think that is wonderful, so that people can all benefit from the Agni one.
Yes, and one of the cases which is very difficult for people also with respiratory problems is emphysema. When people
emphysema.
So you tell me when we can share another one that because there is emphysema, and to me that was like amazing. I could not believe it, because when people had to they had to be taking oxygen and all this, the fear is constant because they could not breathe easily without. But with Homa Therapy, things change. Anyway,
and it's so strange, that with all the scare about how chronic obstructive pulmonary diseases, is commonly
Yes.
telling people about no smoke, no, no
Yes.
fire, no smoke. And then, we have this, this smoke and this fire that can just remove the chronic obstructive pulmonary disease. That is amazing. Dr. Girija, you've heard what we have been talking about. Do you have any input on this?
Yes, Dr. Lennie, like I would like to add a few things, like along with the like we have developed on the basis of this Homa therapy as Agnihotra therapy as a main therapy. We have developed the 5-step program to heal all the diseases, where Agnihotra and its atmosphere, its fumes are the main therapy which we are giving. Along with that, we are prescribing the specific diet according to the constitution of a person. So we evaluate a person when that person comes to us. At that time, we evaluate its constitution, whether it is that person is allergic to specific food or some like we evaluate like is it a vata, that is air predominant constitution, or pitta, that is a fire energy dominant constitution, or a kapha, that is a water energy dominant constitution. Based
So,
on
so that is very interesting,
Yeah.
because you're looking at it from the Ayurvedic side,
Yeah.
and it's a great way for us to compare how Ayurvedic side and both allopathic medicine and non-allopathic medicine both are in agreement that this Agnihotra is something special. So that is amazing. Yeah, Dr. Abel, can you show us your next testimony?
Okay, let's go for the tough cookies. That is emphysema. Somebody who have close to 30 years with this disease, who was diagnosed first in Ecuador, but then because he wanted to get the best treatment, he went to the US, and the diagnosis was again the same thing in the US. Let's roll. Now, in this case, there will be two pathologies. One will be the emphysema, and another one you will know at the end. Usually, we're separating this seminar by systems, and here is respiratory system, but it happened to be that sometimes people have different problems that they get here of all the problems. Let's see.
That is another amazing testimony, Dr. Abel. Did he have what disease did he have? Emphysema?
No, he have skin cancer. The last one was skin cancer.
He had skin cancer because I saw all the protrusion from his skin, right? Skin cancer, right? Yeah.
Yeah, that was skin cancer. That's scar tissue after all this problem they have. But he, did a fire to the ash, put the gig with the ash there, and everything healed. Only left the scar that was there, but no more problem. And a disease that he had for 30 years with emphysema for 30 years, and he could not completely. Now he could go, walk, run, die, everything, and no problem. He doesn't have to worry about.
So he had skin cancer and emphysema from many years, from childhood. That is so interesting, because emphysema, it damages the alveoli of the in the lungs, right? And for him to be able to get past that damage alveoli and to get the alveoli to be fixed again, I find that to be miraculous. What do you think, Dr. Girijawa? What do you think about that testimony? Emphysema, skin cancer. What is your take on it? Can you give us a very short take on your opinion?
We have observed that the respiratory system is connected with your skin. As in Ayurveda, the skin is a reflection of your digestive system. So while treating a respiratory system, we have to first cure your digestive fire, which we think it is one of the factors which is important in our life. So this is very much possible that we have to, while giving the medicine for your respiratory system, we have to first correct your digestive fire. We have to control the diet. And that's why along with these medications, this is very much possible.
So you're saying that, our gut has got a lot to do with the effect that it
Yes.
has on our skin.
Yes.
And so, by correcting the gut bacteria, the microbe in the gut, we can
Yes.
basically improve a lot of the problems that we face, as with the skin and with the respiratory and all that. And our lung system is very much connected to our skin health as well.
Yes.
I guess because holistically we are all very much
Yeah.
connected,
Yeah.
the whole system, isn't it? Yeah, okay. We have time for one more testimony, Dr. Abel, on respiratory. Today we are talking on respiratory. We have one more, one more, we can do one more.
Okay, let's go for another one.
Let's go for another one.
Okay. Okay. Okay, let me give you a background on the next testimony. This is a man that his younger times, he used to fly a small airplane, very small plane, fumigating the fields. The many banana farms, they fumigate and they throw all these chemicals, but he will fly and he will, this is one or two passengers plane. So he said he didn't like to use the top of the plane, and he fly down and he will fumigate all this. He did that for many years, but as a consequence of that, he developed respiratory problems, and he was just emphysema, and he could not walk too much. He could not climb the stairs. He could not do many things. He was old and very sick. And somebody told him about Homa Therapy. He said, okay, let's try it. There is nothing,
Nothing to lose.
We get a hopeless case. Those ones that have gone everywhere. There is no any other place. They're the ones who sent to us. Okay, so he comes. And you will see now he's giving the testimony. Okay, you can see he was a smoker also.
Yeah,
Dr.
up to 3 packs. Up to 3 packs.
Yes, 2 to 3 packs. Dr. Bullo, un fumador por 30 años, de 2 a 3 paquetes.
Sí, puedo comprender.
Turning over on the bed caused him fatigue.
Amazing.
These are the medicine that he was taking before. That is his wife. Next to him, that is his wife.
It is amazing. He can't even turn over without feeling fatigue in his bed, and then
Yes.
he can now go to the gym, right?
And do weights in those ways.
Yeah, and lose weight and go to the gym and lose weight. That's amazing. And looking at the medication that he's taking, yeah, they really didn't think that they could cure him, right? I mean, after all, he has got this pulmonary emphysema, which is also known as chronic bronchitis. Yeah.
Yes. Here he's saying about that he was a pilot for airplanes which were fumigated.
Mm.
Okay.
He lost all his hair because of that.
Because the wind blowing to them. You know how it is.
Oh my
Anyway,
God. Yeah,
so
that is amazing. I mean, yeah, thank you, Dr. Abel, for collecting this series of testimonies. Dr. Girija, do you have anything to add to this?
Dr. Lennie, my husband, Dr. Purushottam, he has just arrived. He would like to join this for a minute.
Okay,
Yeah.
Sure.
Please.
Sure. Is he here now?
Yeah, he has just arrived.
Okay. Good
Hello, Dr.
evening,
Lennie.
Dr. Puru Satta.
Evening. Namaste. How are you?
Namaste, namaste. Good to see you.
Yeah,
We
good to see
miss
you
you
after.
we miss you in Malaysia already. How was your trip back?
It was very interesting. I've been here since yesterday, and
Okay,
a
okay.
lot of work pending in the various works that we are doing. And from tomorrow, I go for a 10-day program in Mumbai.
Oh wow. Okay, okay.
So this is a program. It's an event. We have a festival we have been doing for the last 150 years.
Wow. Okay. So a lot of people are going to get healed in that. We were just talking about respiratory diseases and respiratory illness today. Yeah. And
Interesting. Interesting. I was watching her prepare for it in the morning. And it's interesting because the way Agnihotra works in wellness, especially because Agnihotra has a wider application in various other aspects of human life as well, like agriculture, education, water purification, air purification as well. And here you are talking about, especially with her work about Agnihotra wellness. So Agnihotra, how to understand Agnihotra's work in wellness, basically a little bit Ayurvedic background is very important, because then it really starts explaining itself, because it comes from a therapy from the Ayurvedic fraternity, from the sciences. So if you understand a little bit about how disease starts in the Ayurvedic background and how Agnihotra comes in and takes care of it, then we can correlate with modern scientific research and then really understand the efficacy Agnihotra has. Because especially respiratory diseases is very important, because respiration is directly linked with prana. So no other part of the human body is directly exposed to the environment other than your lungs. So every second we breathe in the atmosphere in and throw it out all over again. So so when the food we eat, we chew it and we take it into the stomach. The intestines are not directly interacting with the outside world. Your kidneys are not directly interacting with the outside world. But your lungs and your respiratory system directly interacts with the world outside. That's why Ayurveda says that you're taking prana, life energy from the universe, and keeping your prana alive. So this respiration, Ayurveda says, keeps your digestive power or your life power alive. Like,
thank you very much, Dr. Puru. I totally agree with that. Dr. Abel, can you explain that in Spanish? What can you summarize what Dr. Puru said in Spanish?
Bueno, okay. El doctor Purushottam está diciendo es mucho más fácil comprender las bondades del Agnihotra a través de un conocimiento básico de Ayurveda. Entonces, a través de cómo se purifica, el Agnihotra tiene efectos en toda la naturaleza y puede ayudar a sanar todo tipo de enfermedades. Esto es el básico. I try to summarize very small because it's a little long topic, but that's what we can.
Yes. Thank you very much.
Maybe I can simplify it for you, Abel. Maybe I'll simplify it for you. So what you can say is our breath keeps our life alive, right? There is a fire within us which is kept alive by the prana from the atmosphere. Like any fire in the world, you can't burn in vacuum. You need oxygen for it to burn, for combustion to happen. Similarly, for metabolism to happen, you need the air from the environment to keep it alive.
Yes. That's what we started with, remember? About the inspiration, the air and all that. Yes,
Yes, that was what Dr. Abel was talking about earlier. Thank you, everybody. I think it's 9:30. It's very, very late now in Peru for Dr. Abel and for all our guests from Peru, Ecuador, and Mexico and South America. Thank you so much, Dr. Horacio, for your question. I will pass the floor back to our president, Ong Hooi Lin.
Dr. Lennie, one question. I'd like to make some observation if possible.
Yes.
You see, in the conventional Ayurveda, one of the keys to promote health is improving the digestive fire. This is a very important, the digestive fire, it goes all around the first and so on, and it works very well. However, we might want to add something else. You see, there are people who supposedly they have good digestion, they go regularly to the fire, they are vegetarians, they do all these kind of things, and they're still sick. They still have problems. Now, this is not to believe anything. This is only an idea we're throwing for you to think about it. It is also said that as similar to the solar plexus, in the abdominal area, there is a fire and the digestion and so on. There is also a fire in the heart. In the heart area, there is a fire also. There is a fire on the here. There is fires everywhere related to the chakras. What about if you activate these fires? I can tell you this, from the emotional point of view, many diseases have some origins there from the emotional point of view. If we can treat the heart from the emotional point, people can become loving and kind and so on, independent of their physical health. There is something, another great miracle happening. These Homa fires will activate all the inner fires, the gastric fire, the one below that, and on the other ones at the top. This is only for you to theorize, but our experience tell us this: the transformation not only goes on the physical level, it goes in the emotional, the mental level. Let's not talk about other levels because there is other levels. But these fires, definitely, they have some divine, or you might call it special qualities, which are, it can be put into practice by anybody. You see, many of these people, they live their continual life. They overcame the diseases and they didn't change. I didn't have to tell, you have to stop eating meat. You have to. We recommend them to have an alkaline diet and forget about all the meats and all this. But this gradual, it's a gradual process. It's a gradual process. These Homa are so powerful that even the hardest, most difficult, mind-twisted, emotional, deprived, and physical handicapped people can benefit. Anyway, this is just an idea.
At the end of the day, Agnihotra does align all your chakra energies in single line every morning and evening. So
Yes,
that is the textually, philosophically proved point. And that's the reason the healing occurs. So you can take Agnihotra and heal whichever system of the body you want, because at the end of the day, your astral subtle bodies are not connected directly with the environment in the first place. They're more subtle in energy. So the Agnihotra energies emanating are impacting your subtle body, your koshas, and activating your chakras. That's where the healing comes. So Agnihotra healing the respiration, Agnihotra healing the skin, Agnihotra healing the heart. That's where the healing comes in. And that's very individualized to everyone. So it's mostly connected with everybody's spiritual and emotional vibration. So that's how Agnihotra basically starts acting. So what we are trying to understand is Agnihotra from a very physical level, where the fumes and the ash are the limited source of exposure to our being, but it's vibrational and spiritual energy that emanates from the pot heals at a very deeper level.
Thank you very much to all our panelists tonight. Thank you. Namaste.
Thank you. Namaste.
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 And I will hand over everything to our president, Dr. Ong Hooi Lin.
I'm not a doctor. I just I'd like to thank you, everybody. Actually, tonight's topic is closely related actually to my own family members, because I have two boys. One have eldest one have asthma. The second boy, who is just turned 7, have eczema. But they are cured for I think 4 to 5 years already. They are asthma and eczema free for almost like 5 years already. So I'm truly grateful for that. So today's topic is really like touching my heart so closely actually. And today actually I am also like daytime, I'm also running the aromatherapy certification course with my school principal, aromatherapy school from China. So we also talk about, share with all the students about chakra. So it's like all the topic like come together and sing together. So before I end the session, what I want to just share is like, I would like to thank especially to these 3 our invited special guests for today. Thank you, Dr. Abel. who is actually like so dedicated, and he compiled all the cases, make into all the translated video. Thank you, Dr. Abel. And then thank you, Dr. Grijo, and thanks to Dr.
Thank you.
Puru, who because of Dr. Puru, and we got to know you. And thanks to our founder for I-Inspire, Dr. Lennie Soo. And this is some background about our speakers of today. And without further ado, and since no further questions, I would like to invite you to share, to join us for the next one. We have a series of webinar. Our main monthly main speakers will be Dr. Abel, who is actually originated from US, but now he's based in Peru. Our next one will be on CNN system. If you have anybody, which is your, let's say your friends, colleagues, or any family members who have any CNS nervous system, please join us. Our next monthly webinar will be on the 11th of August, which is next month, same time again. If you're in India, will be 3 hours earlier. So that is our plan, 1.5 hours. We will discuss. We might have different guests from all around the world. So please join us. This is our next month's sneak preview of our coming clinical webinar. And then for those who are based in Malaysia, if you want to know how Agni Hotra is being performed, please feel free to drop by the rooftop of 360. Wellness is a medical center. So please join us on the rooftop. We are going to do together. If you're not sure, you have questions, please come and join us physically. For those who are not in Malaysia, please join us via Zoom. And this is what we plan to do on monthly basis. And this is what we just ended last week in our holistic healing retreat in Malaysia. Thank you, Dr. Puru. He actually guided and led our whole Agni Hotra session, and he made everybody wake up so early every morning. Thank you again, Dr. Puru, for all the hard work and came all the way to Malaysia, and just to share with you how beautiful the place was. And thank you, everybody.